When developing the skill of how to use high volume suction, retraction, and indirect viewing, it may take a little bit of time to get used to using both hands simultaneously. This is a brand new advanced skill where one is managing all three tasks at once. We're going to show you how to use the Newbird suction mirror for retraction, for suction, as well as indirect vision. The first step in getting comfortable with using your Newbird suction mirror is for retraction. One of the great benefits of the Newbird suction mirror is when you're working on a patient who has tight cheek muscles, it's excellent to hold back for retraction. You can pull back these tissues, and with a simple rotation, you can also have that continual viewing of the buccals, and you can move the Newbird suction mirror from one side of the mouth all the way over to the other. And as you can see, as I'm moving along from the mandibular arch to the maxillary, I simply rotate and use the swivel feature of the Newbird suction system to hold back the cheek and the upper lip without any discomfort to the patient. The Newbird HV suction mirror easily and comfortably retracts even the most thick and wild tongue while allowing better access to those tough to reach areas. Notice how easy it is to hold the Newbird suction mirror with the modified pen grasp. You have wonderful viewing of both the buccal and the lingual surfaces. You can easily maneuver from one side of the mouth to the other with an easy swivel and rotation movement. The Newbird suction mirror is angled so it adapts to the shape of the mouth and retracts better than a straight HVE tip. It won't plug with tissue and bog down in performance when placed against the buccal mucosa because of the patented hole design on the mirror head. And as I move forward, I'm going to change my seating position up to the 11 o'clock. And I'm using the mirror again for the retraction of the buccal mucosa and the suction, of course. And you're going to find that occasionally you are going to use the mirror to collect the pooled water at the back of the patient's throat. Coming around to the 12 o'clock position. And this is where you're going to find that you're going to collect that pooled water when you're working with the ultrasonic on those anteriors. Additionally, you're going to find that you're going to need to go down to the side of the mouth, to dip down to the side of the mouth to collect the pooled water that has been collected. As you can see, when using the Newbird suction mirror, the aerosol coming from my ultrasonic tip is being suctioned up by the Newbird suction mirror. The Newbird suction HV mirror allows the clinician to keep the evacuation close to the area being instrumented and allows one to use indirect vision with clear viewing. Sitting at the 12 o'clock position is more ergonomic with the new bird mirror, and it allows for easy access for the clinician. This is important when working on the lingual of the anterior teeth because it allows better visibility of the ultrasonic tip adaptation to the areas easily missed. Now I'm going to demonstrate how to use all three of the skills of the retraction, of the indirect vision, and the suction to clean a patient's mouth. I'm going to start working on the lower left quadrant, and as you can see, I'm sitting between the 10 o'clock and 11 o'clock seated position. I'm going to use the new bird suction mirror first for retraction of the cheek tissue. And as I'm scaling the distal buccal and then moving over to the direct distal of number 18, the new bird is functioning in two ways. It's one, retracting the buccal mucosa for me, and also collecting the aerosolized water. Now, as I'm going to move to scaling the maxillary anteriors on the lingual surface, so I go from retracting the tongue and collecting the water and swivel my mirror, my new bird suction mirror, and start working on the lingual surface of these maxillary anteriors and incisors. I'm tilting my mirror. I've rotated the mirror with the swivel action so that I can view the linguals of these anteriors much better. I can see everything I need to see. And some of the water has pooled, so we're going to have the patient just close up on that one like it's a spoon. So this area that I'm working on here, we're going to use the new bird suction mirror for retraction, for indirect vision, as well as the suction capabilities. I'm going to start using the ultrasonic on the distal of tooth number 2. And it's providing wonderful indirect vision. I can see everything I need to as I come forward towards the midline. And as I move forward, you want to keep the new bird suction mirror as close to the ultrasonic tip as possible, but yet you will find that some water will pool at the corner of the mouth, and you just use the swivel action of the new bird mirror to collect that water.